All right, thank you, Jason. I've given talks on this very topic, and I really do love that photo that you just showed about the difference between equality and equity. We talk a lot about equality, providing the same for everybody. In healthcare, particularly, you may have to go the extra mile in order to make sure that it's equitable. Because providing the same thing may not give you the same outcome. So it has to be about the outcome. So you may have to do a little bit more for one population in order to get them the same outcome. Very, very important. And then I want to put in a plug for research with our patients that we see out there. We do have a lot of very new and exciting drugs that are being tested. At West Clinic, for example, when we look back, like 90% of the drugs that were approved, we had it in studies at West before. So our patients actually getting those drugs before they actually approved. And so think about that when you see your patients and refer them in. One last thing, I want to invite Leanne from the West Cancer Foundation to talk in 2 minutes about what they do. A lot of the funds that come out from these sort of programs we do go to the West Foundation, and they provide service not just for West cancer patients, but for all the patients in the community.
Thank you, Dr. Vidal. Good morning, everyone. I'm so happy to see everyone here. There are some of my absolute heroes sitting in this room right now. Dr. Vidal, Dr. Ben, Dr. Porter, Bernie Crook, who was just honored being named this Distinguished Visiting Professorship at the School of Nursing at UT, was named in her honor. So thrilled to have Bernie here with us. And Jessica Dugan, who works very closely with us. She is on our Young Professionals Advisory Board. And she is phenomenal in helping us, and she believes so much in our mission. So what is our mission? Breaking barriers to cancer care. Very simple. We are trying to find all areas where patients are not getting the care that they need, or the tests, the screenings, and we are trying to help them. So the programs we provide, free breast screenings, everything we provide is free. So free breast screenings for women. We had just launched a prostate screening program, and we're going to do at least 2 this coming year. Our friends at Johnson & Johnson are interested in working with us on that, so we're thrilled. So many of our pharma folks support our West Fight On event, our signature event, and work with us throughout the year, and we're so grateful to all of our pharma friends. We also provide free transportation, which is the largest program in our pie chart. You'll see that it is the biggest part of what we do. It's the second largest line item in our budget. But that is so critical because we will provide transportation to any patient, regardless of the provider, for any cancer-related appointment for screening. So we actually have patients that come to our Sweet Wig Beauty Boutique, which is another program that we have, which is a lovely room in our offices. And it's set up like a spa type atmosphere. Ladies come in and they can try out as many wigs as they want. We have a team here that's dedicated to doing that. The ladies come in and they're scared, and they're sick. They're embarrassed because they can't afford a wig. By the time they leave, our young lady that handles that program, they are laughing and cutting up and so excited, wearing their wig out. And so that's something that's the smallest item on our line item in our budget, but it means the world to those people because no woman should ever have to make the choice of, I've got to put food on the table for my kids, or I've got to put gas in the car, or buy a wig. We have over 400 in stock. So all of your providers here, please make sure that all of your teams, your nurses, and everyone know about that program. We also provide free lymphedema and post-mastectomy garments. Those programs have been around for a while, and they run pretty smoothly. But you all know lymphedema products, wraps, bandages, et cetera, they are very expensive. If you don't have insurance, you just don't get it. And we all know that can be debilitating to the patient. Same with post-mastectomy, help women feel whole and proud. So those are the programs. We just launched a mental health screening program for cancer patients and or their caregivers and family. Mental health is so important in what we do, and sometimes it can be overlooked because we're just trying to treat the body. But mental health is incredibly important to the patients. We also fund a lot of research and fellows and residents at UT Health Science Center. We're so proud of our relationship with UT. We have funded over $2.5 million since we started in 2020 to UT for fellows, residents, and we're now working with the School of Nursing on some oncology nursing programs, which is what Bernie was honored for. So we're doing a lot, and we love what we do. I have a dedicated team. And just please help spread the word about the free programs that we have, because we want to make sure that everybody who needs our help, they're able to get it. And thank you so much.
All right, thank you so much. I'm going to tell you of one quick story regarding the foundation that is personal to me. We've done a lot of work raising funds for the foundation. This accent I have, I'm not putting it on. I'm from a small island in the Caribbean called Dominica. We're not going to talk about my father and his exploits, but I have sisters who are not with my mom, and their mom just got diagnosed with breast and cervical cancer. Well, sorry, uterine cancer. Care wasn't the best in Dominica, so I brought her up. At West, one of the things I couldn't do is drive her to and from clinic different times. She went the first time and she came back with a whole schedule of Uber rides that's provided by the foundation to get her to and from clinic. So this is sort of the things turn around, and it's impacted me directly. So again, thank you for what you do. We have a 10-minute break for breakfast, and then we'll get back in here to finish off the day. Okay, thank you.